Hello friends, welcome to this second pre-session series for the AIIMS discussion. Uh, I'm sure you know that this video is somewhat delayed. This was unavoidable due to certain technical issues, but nevertheless, let's quickly begin with the pre-session 2 for the AIIMS discussion series. As you know, in the pre-session 1, we had talked about the important subtopics which have been asked in the AIIMS exam in last 7 years from the general biochemistry, from the carbohydrate section, and from the energy metabolism section. Today, in this pre-session series, we'll be talking about the subtopics coming up from the lipids, from the enzymes, and the amino acids and proteins. Let's start with our discussion. I'll project the screen where we have this list ready for you. Okay, let's see. Right. So this is the pre-session series for the today's session. All right. So starting with lipids from the section of the chemistry, we have one or two questions from classification of lipids, particularly about which of them is sphingolipid, something like that, and one or two clinical cases from the sphingolipidosis. One or two clinical cases from the sphingolipidosis. All right. Clinical case, you'll get the features. Features are described. The biochemical findings are given, and you can be asked about the disorder per se, or rarely you can be asked about the enzyme deficiency which may be seen in these cases. Moving on to metabolism. Metabolism is not asked in much detail. For example, effect of hormones on specific reactions or on the concentration of the lipids, different lipids in the serum. Then fatty acid catabolism. Fatty acid catabolism. In this section, questions about which particular fatty acid will get broken down where, and multiple clinical cases from the Zellweger syndrome. This question is asked in multiple ways. With about three questions are there from the Zellweger syndrome, and certain question from the lipogenesis. Very briefly, very superficial question. And there's one question talking about the components of the fatty acid synthase complex. So very superficial questions being asked from the metabolism per se. Talking about the ketogenesis, here, the details of the ketogenesis per se have not been asked. One question has been asked talking about the ketone bodies in terms of the fuel, in terms of for which tissue are they acting as the fuel, for which tissue are they acting as the fuel. Again, coming on to the cholesterol synthesis, the question has not been asked about the details of the synthetic process, the five divisions of the synthesis that we talk about. Rather, a very straightforward question: what is the limiting enzyme for cholesterol synthesis? So like I've been saying repeatedly, for the lipids you don't need to go into the details. Just an overview of the topic is more than enough. There's no point in wasting time by going into the details of the lipids. The only topic which I always emphasize is very important are the lipoproteins. The lipoprotein section is very important. You should have good command over this topic. Now, there is something called Friedwald formula. It is asked in multiple ways. Particularly, it relates to calculation of LDL values from the concentration of total cholesterol, HDL cholesterol, and the triglyceride values. So that question is asked. Again, classification of the lipoproteins, fairly commonly asked. You should know. What about the chylomicrons, HDL, LDL, VLDL? What are their properties and their relative protein content, their relative lipid and protein content? Now, in terms of lipoprotein, we can have the various disorders. They can be inherited or they can be secondary hyperlipoproteinemia. So this one question each has been asked from them. The secondary hyperlipoproteinemia, particularly it relates to the lipid disorders in diabetes mellitus. Alternate question can be from hypertension, but the question which has been asked was from the diabetes mellitus section. So that is all about lipids. As you can see, no need to go into the details of the lipids per se. You should know about the classification broadly. You should know about superficially an overview about the metabolism, about the ketone bodies, and what you should know in detail is about the lipoproteins. Lipoprotein is a focus because it has a lot of clinical applications. So you should know very well about the lipoproteins. Let's go on to the enzymes. As you can see, very limited questions from enzymes too. One question from enzyme kinetics, another question talking about the activation energy, another question talking about catalytic efficiency, multiple questions from classification and the special subtypes. So this is the part where you should focus. You should talk about the classification, the special subtypes, for example, what is the property of suicide enzyme, what are the different types of allosteric enzymes, which are the specific properties of the allosteric enzymes. So these are some points which you need to know from the enzyme section. All right. And the last part that we're going to talk about in this session is related to the amino acids. Amino acids is significantly large. A lot of questions also come from amino acids, but some sections are asked more frequently, more in detail, and some sections are completely skipped. So you should know which sections to focus on and which sections you can afford to skip. Most important section is the classification. Rather, I would say the most high yield section is the classification. As you can see, 4 questions have been asked from the classification. 1 question each from the titration curve and the anaphylactic reaction chart that is there, where the amino acids are entering the Krebs cycle, which of them is getting converted to pyruvate, which of them is getting converted to succinyl coenzyme A, which is getting converted to alpha ketoglutarate. So that chart is which is there. You should know about that. It has been asked in the past. One question about the properties and one question about the special products. All right. About metabolism, again, one single question is there. From ammonia transport, also one question is there, which molecule helps to transport ammonia, like that. What is very important is the urea cycle, and that too the biochemical management. Twice the question has been asked on the biochemical management of urea cycle, and what are the different disorders related to the urea cycle. You must know about them. They have been asked frequently. Among the other clinical conditions related to amino acid metabolism, most frequently, most important to know is the phenylketonuria. You cannot afford to not know about the phenylketonuria. It is one of the most common causes of retardation. You must know about that. And another is related to tryptophan deficiency. Image-based question has been asked from the tryptophan deficiency. So these are some topics which you need to. As you can see, the details of the breakdown of the carbon chain of amino acid is not asked. It is not asked in detail for last so many years. So there's no point in wasting your time talking about the metabolism of the carbon chain of the amino acid. So rather you should focus on the metabolism of the amino group, that is the ammonia metabolism and the urea cell. Though that is the part where you need to focus in the amino acid metabolism. Moving on to proteins. Question talks about functions. What is the secondary structure helping with, tertiary structure helping with, quaternary structure helping with, what are the different bonds, and how the function is achieved. A lot of questions from collagen. One question about composition, one question about distribution, and how the concentration or the type of collagen changes with the stage of wound healing. All these questions have been asked. So you should know the collagen distribution. In the past, we have also had questions on collagen related to defect in inherited disorders. Multiple questions have been asked related to defect in inherited disorders. So you must know about that. They have been asked in the past multiple times. Among the proteins, by far the most important section is the heme metabolism. I would say it is a very high yield topic in the protein section, the heme metabolism. Question has been asked from biosynthesis, 2 questions from biosynthesis. What is the relationship of lead poisoning in heme synthesis? Again, 2 questions have been asked. Related to synthesis, question has been asked about substrates, question has been asked about in which compartment the synthesis is occurring. Then you have been asked questions about the hemoglobinopathies, HBS, and two questions have been asked about HBS, the mutations which are there, different types of hemoglobin during embryonic phase, fetal phase, neonatal phase, adult phase. This is something you should know, and interaction with 2,3-DPG and how it affects the hemoglobin oxygen dissociation curve. All these questions have been asked from the heme metabolism, which shows that heme is a very, very, very important section. Questions have also been asked in the surgery and pediatrics about the bilirubin. So I would put that also in the heme section. So it increases the weightage of the heme section. So I'll stop here for the P session 2. We talked about the lipids. I told you that you should have a brief overview about the lipids, and we highlighted the important sections. Then we talked about the enzymes. What are the points which you need to know in enzymes? And then we talked about the amino acids and the proteins. The most important section to know here would be the heme metabolism. And we'll stop here. In the next video, we are going to be talking about the molecular biology. We will talk about the uh, nutrition, we'll talk about vitamins, we'll talk about minerals, we'll talk about techniques, and we'll talk about the miscellaneous topics which are being asked. Thank you very much. Please do subscribe to our channel so that you can get updates about our upcoming videos. We are going to be posting the series here in audio. So thank you very much. Take care and be safe.